Good afternoon, everyone, and thank you for having me here today. And I also want to thank the panelists and our moderator, because as was mentioned before, we had a very dynamic discussion that really pulled out a lot of salient points to kind of help us pull our panel together. So I'm going to be speaking from the perspective of FDA, and I'm actually going to go before the clinical trial even starts. So we've heard a lot earlier today about what happens, at the clinical trial phase with consent and documentation and things like that. But our work starts before the trial in raising awareness around why we need diverse participation in clinical trials. So our mission in the Office of Minority Health is to create a world where health equity is a reality for all. And a key component of achieving health equity is addressing health literacy. So one area of interest that we are involved in is making sure that we promote better informed decision-making about our FDA-regulated products. We've heard earlier today about how the patient should be a critical component of the decision-making process, and they should be involved at every point in every stage of the clinical trials process. We want to make sure that groups like racial and ethnic minorities, groups that may have limited English proficiency, low health literacy, veterans, youth, LGBTQ, and other underrepresented populations have the health information they need in a manner that they can access, understand, and most importantly, comprehend. This is so they will be able to make a decision about their health for not only themselves, but also for their loved ones. Improving health literacy among our populations is critically important to reducing health disparities, because we know that low health literacy does have an impact on a person's ability to make a decision about their health on a myriad of issues. This can range from knowing how to read a medication label, knowing how to check their glucose, and understanding what does that number mean. When we talked about informed consent earlier, do they understand the documentation that's been given to them? When they're looking at recruitment materials to even know if they're eligible for a clinical trial, should they pick up the phone and have a further conversation? Do they even understand what that inclusion-exclusion criteria means? So we have a very specific focus on making sure that we are creating not only culturally, but also linguistically tailored clinical trials, health education, resources and materials that are written in plain language at all literacy levels, so everyone can comprehend and be able to understand the materials. If you look in your program book today, we do have one of our clinical trials fact sheets that you can see. And what I heard earlier today from one of the speakers, like, we're all lay in some area, right? So we need to make sure that the materials that we are producing are available and accessible to everyone, despite your literacy level. We know that about 9 out of 10 Americans are considered low literate, and it cuts across all areas, like education and income, for example, and even the most savviest person can have a low level of health literacy. You can imagine if you go to the emergency room right now with a health issue, your literacy level is going to be way low if someone is handing you a bunch of information about this emergency that you are having. So we need to make sure that all of these materials are written in such a way that they can be understood. One of the ways that we accomplish that is making sure we're working with our stakeholder groups. We want to get the buy-in and the support. We want to understand areas where we could improve our materials, making sure that we have indeed hit the target for the message that we're trying to convey. I saw another presenter earlier mention CDC's Clear Communication Index tool. That is also a tool that we use in our office to make sure that, we've hit all the check marks and we've made sure the material is as clear and concise and understandable as possible. And then we also do message testing. So we have panels of consumers that will actually look at our materials and say, is the intended message what we thought it was? Do these graphics resonate with you? Is the information clear and easy to understand? Is the white space to text ratio right? Are we using bulleted lists and numbered lists to make sure the information is very easy to understand? So when we're talking about clinical trials, one of the initiatives that I lead is our diversity and Minorities in Clinical Trials initiative. And with this initiative, we launched it a few years ago. It is a multimedia campaign to raise awareness about the importance of minority representation in clinical trials. And one of the things we wanted to do with this campaign is to make sure that we were dispelling some of the myths that a lot of our racial and ethnic minority communities have about clinical trials. We wanted to make sure that we are introducing positive messages about clinical trials into the atmosphere. When we're talking to our racial and ethnic minority communities, a lot of times what we hear is, we're not really concerned about why there's the problem. We want to know the tangible information that we can take to make a decision now. And that's what our campaign is here to do. We talk about, you don't necessarily have to be sick to participate in a clinical trial. Many people think that a clinical trial is a last resort measure, and that's not the case. There have been some historical abuses among racial and ethnic minority groups, so we do talk about that. We talk about how safety is of a concern, how clinical research is voluntary. You can leave at any point in time without any penalty. Within this campaign, we were also very cognizant to make sure that we had representation of each community. So far, we produced 9 public service announcements. The first 6 of those public PSAs were actually featuring an FDA patient representative, and she's an African-American female living with sickle cell disease. So she was the spokesperson for that campaign, and it was very important to us to have people within the community be the spokesperson to make sure that we're putting out credible information, making sure that the people who are using our material see themselves in the material. So we never want to come to the table and just push out a material and say, here you go, we're FDA, we produce it, it's the greatest thing ever. That's why our stakeholder engagement is very important, because we want to make sure that the materials we are putting out will resonate with the intended community. We also have some Latino videos that were done in Spanish. We have videos that feature veterans as well. So we're making sure that we're including more and more information to address the needs of multiple different populations. We also started doing podcasts. We have, as I mentioned, the fact sheet before, so we have other print materials, including a brochure. We also, all of our materials are available online. They're free of charge, and we will ship them. We also have a very robust social media. So we're on Twitter and we're on Facebook. We have a blog and a newsletter, and we send out e-alerts. And then we also have a dedicated website for minorities in clinical trials where all of this information is housed. And then we have a communications toolkit for stakeholders. So anyone who wants to use our materials, we already have some pre-canned messages that you can use for social media or for your own blogging and newsletters, et cetera. And I think all of this is very important in the health literacy realm, because you need to present the information in multiple different ways. We don't take a one-size-fits-all approach. We know that our communities need multiple types of information. So we have the videos that's reinforced by the fact sheets, that's reinforced by the social media messages, that's reinforced by stakeholder engagement, which includes coming to meetings like today and other stakeholder meetings and conferences, et cetera. So we have this multimedia approach to make sure that we're hitting it from all fronts and that people can get the messaging in different ways. And we know with anything, reinforcement is really key. You have to keep putting the message out there over and over. I'm not sure how much time I have left, but I do want to close by saying that, we address health literacy by using plain language, avoiding the use of jargon. As scientists, sometimes we get bogged down into the scientific and technical accuracy of our information, but if no one can understand it, then it's not useful. So we need to break that barrier down and use the plain, clear, concise language to get the point across. We also want to make sure that we are assessing our audience's needs. We don't ever want to assume that our particular strategy is the right strategy. So we want to do our formative research ahead of time to make sure that we are indeed using the right strategy, and we're also having the information in the most accessible form, And then also, what are the effects of the existing communications? There's no need in reinventing the wheel if there's already something out there that may be working. And then also, I feel like the main key is making sure that we know our audience and that we're tailoring our materials appropriately. When I mentioned earlier that our materials are culturally and linguistically tailored to each individual community, we do actually have a language access program that my office leads within the FDA. And as a part of that, we make sure that we are translating materials for different populations. Automatically, we'll do the top 5 spoken languages, and then we'll do other languages as needed, but depending on the health condition that we are trying to address. Before any translations come out, we make sure that we have a group of native speakers within the FDA that will review the translated materials just to make sure we didn't miss anything during the translation process. Because the worst thing you want to do is put out information that may be offensive to a particular group of people. So we want to make sure we avoid that at all costs. And I think lastly, we make sure we keep the patient in mind. They are at the center of everything that we do, and we want to make sure that they have the critical information that they need to make a decision about their health. So I will stop there.